get straight down with the show. India is edging closer to the 1 crore mark of COVID-19 cases. Ahead of that, the government has come out with an exhaustive FAQ, frequently asked questions for the vaccination. Remember, 2 weeks ago, you started seeing the vaccination drive in the United Kingdom. The United States has started it. That's all the Pfizer vaccine. Back home, you are seeing applications in for at least 3 vaccines for authorization. This is a big story today, the FAQ that has been put out by the government, which also says inoculation in India should begin. Joining me to talk about this is Dr. K Ganguly, the former DG at the ICMR. Dr. Ganguly, thank you for joining us this Friday on ET Now. This is Nayantara Rai. You know, it's an FAQ that runs into a couple of pages where it's once again explaining how this is going to be voluntary, but those above 50 should go in for an inoculation. The entire registration process is going to be pre-registered. They're given a list of documents that will be needed. They've also reiterated, and something we know about from what's happening in the West, you'll need 2 doses with a gap of 28 days, and it's after your second dose that antibodies are built after nearly 2 weeks. My first question to you is, it's going to be perhaps the world's largest inoculation program, the world's largest vaccination program in the fight against coronavirus. We still don't know which vaccines are going to get approval. We don't know the kind of logistics that will be required. For example, all the vaccines that are under consideration need to be at different temperature levels. Some sub -20, some could be at room temperature. With your experience at the ICMR, what all kind of preparations are indeed needed? We saw a health ministry briefing also earlier this week where they talked about coolers and deep coolers and all of that.
Actually, at this given moment, the dry runs have already started. We have a priority list. We have priority 1, 1B, 1C like this. And we have started registering the people also who will be getting it. So as we know that the first persons who will be getting it are the direct healthcare workers who are taking care of the COVID patients, like those who are working in ICUs, those who are working on the diagnostics, those who are ferrying the patients and taking nurses who are taking care of the patients. After that, the other doctors and other healthcare workers, and after that, the frontline workers and people who are above 65 with comorbidities. So in this way, the priority has been made. The syringes have started getting manufactured. At the moment, India does 0.5 milliliter of an injection. So syringes are being made, one-shot syringes. There is also a preparation for vaccinators. So the trainings for the vaccinators have also started. And the vaccine hubs where the vaccine will be delivered, they will start building up gradually, because at the moment we are not looking at that the vaccine will reach the communities. Like you, for yourself, your turn might come after 30 crores people have been given the vaccination. So that will be a very gradual process. Other preparation which have started is that in IGI there is a storage, cold storage, which has been made, and Emirate, which flies to every city in India, has also a cold storage transportation. Like UPS and FedEx, we also have cold vans which will be taking the containers, cold containers, which will be storing the vaccine. We also have the boxes which will store the vaccines. These are 2-layer boxes in dry ice. So we are ramping up our dry ice production, which we already had the facility. We are ramping up the dry ice production. So now the Moderna vaccine has also been has got the clearance. Moderna actually can be transported at -4 degrees centigrade. So it is not -80. And Moderna can stay for 30 days outside the at 2 to 8 degrees centigrade, whereas the Pfizer can stay for a week. So that logistic is also there. The problem is the production and scaling up. Messenger RNA can easily be made up and can be expanded, but a lipid globule on which this is wrapped, it takes time, and some of the batches may go wrong. So the scaling up is something which vaccine companies are learning. But there are two vaccines which are now available globally, and it will come to India. At least the Pfizer has applied for its clearance, as well as the Moderna will apply for clearance, and it will hit the private market too. Apart from and the government has talked to most vaccine manufacturers. There is one more point that AstraZeneca vaccine, which will be manufactured by BioE, it will be one-shot vaccine. So this is something very good, that this is a one-shot vaccine, and this will not require 28 days interval for the second shot, and that thereby its trial will also be very shorter than the other vaccines. Finally, there are some other issues which we will have to see, that vaccination process will not be very quick. Like in a day, you can maximum vaccinate in one hub 1,000 people, because there will be counseling, there will be injection, there will be 30 minutes to 50 minutes waiting for the SAEs, because SAEs are not that worrisome. These are fever, these are a little bit of joint pain and the pain in the arm where it gets into. Some few people have got Bell's palsy, few people have got allergy. Allergy can be handled because you give an injection of epinephrine, you keep it ready, and if somebody has got allergy, they get an epinephrine and they become okay. Nobody has died of allergy at the moment, and Bell's palsy, which is being seen, is almost same incidence as it happens in the normal population. There is one problem which we are facing now in the vaccine world, that those who are undertaking trial, there is a group which is a placebo. Placebo has not got vaccine. And although at the moment emergency authorization has been given, is being given after 2 months after the phase 3 last shot, they ultimately they have to be followed for 6 months to 2 years. So the placebo group is demanding vaccine now. If you give them vaccine, then you can't follow them up. So there are some issues
Dr.
which are
Ganguly,
cropping up.
Dr. Ganguly,
Yes, please.
Dr. Ganguly, I take those points, and we've been reading about those concerns with the placebo in the trial case as well, and that had escalated too in a couple of weeks ago. But before I let you go, Dr. Ganguly, and when I went through your FAQ, and it's include the government's FAQs, and in fact, even after the guidelines had been put out by the task force, my one question to you is: this is going to be the world's largest vaccination drive in all probability, right? But the entire process will require pre-registration. How feasible, how practical is that? Yes, you have an option of 12 ID cards, but you have to pre-register. You need access to a device. How geared are we for a vaccination drive in India's villages, in the small districts, where we are assuming that people are going to be downloading apps, that we are assuming that they're going to be having smartphones?
Actually, Nayantara, the vaccine which will be moving out to the community, it will take about 2 years, sometimes more than 2 years. So we will have lot of time to prepare ourselves. It will be a gradual process, and it is not easy. We have never done adult vaccination to entire population ever in our life. So this will be a learning process, gradual process. There will be some upheavals which we will have to sort out. But that list is getting prepared. There is a portal where you could uh, enlist yourself, tell that whether you are a frontline worker or not, at which place in the healthcare you are working, what's your age, everything is, this particular group is getting registered. And we have a common ID, that is Aadhaar card, which many other countries don't have. And so for us to register in a particular fashion will not be that difficult. But the priority list is getting registered. So you are getting a number also. So in that particular way, you will be getting inoculated. And mostly you will be inoculated in the major hospitals, which will work as a vaccine center. And in the communities, you may get vaccinated at the CMC level, because vaccinators are getting trained. And in the CMC level and PSC level, we have EPI vaccinators, and those vaccinators have been drawn in. The other places, the vaccinators are already there, the nurses and other people, and it will be possible to do it. So logistic is there. We will have to run few dry runs. For us to get the vaccine, it will be middle of January or the end of January. So we have time. The US did huge number of dry runs, and even now they are getting hiccups. Some of the boxes in which the cold dial is there, they have not worked. Some of the boxes have not reached their destination, and at this given moment, they are cutting 40% of supplies to most places. So we will also go through that. But ultimately, the good news is that there will be more and more vaccines which will get approval, and they will be available. Vaccine choice will not be there in the initial stages. That whatever vaccine you get, you will have to take it. You cannot say that I will take Moderna, I will take Pfizer, or I will take Oxford. This choice will not be with you. You will have to get whatever comes to you, but later on
Okay.
there will
The
be
choice will not
choices.
exist. In fact, the guidelines have encouraged, Dr. Ganguly, that each state should only be using one vaccine. And I guess that's also where logistics are going to come at play. We're completely running out of time, but Dr. Ganguly, it's been a great pleasure having you on the show, because you've helped us demystify a lot that's going to happen, and good news that's going to continue to come in. In fact, we did earlier this week have the principal scientific advisor to the government, Dr. Raghavan, also on India Development Debate, saying the good news as far as the authorization and the approval comes should be in by December.